Have you ever pondered over the silent, unseen threats that could be lurking within your own body? Indeed, it's a thought-provoking question that might send a chill down your spine. Today, we're going to shed some light on one such threat which, despite being silent and unseen, has a global impact that's far from insignificant. We're talking about cervical cancer. Cervical cancer, my friends, is a serious health issue that affects millions of women worldwide. It's a relentless enemy, often creeping up without warning and establishing its stronghold in the body before symptoms even begin to manifest. Let's take a moment to grasp the magnitude of this issue. Globally, cervical cancer ranks as the fourth most common cancer in women. In some parts of the world, it's the leading cause of cancer-related deaths among women. These aren't just numbers, they represent real people, real lives that are being affected every single day. So what exactly is cervical cancer? In the simplest terms, it's a type of cancer that begins in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. When the healthy cells in the cervix develop mutations in their DNA, they begin to grow and multiply at an uncontrollable rate, forming a mass of cells or a tumor. If left unchecked, these cancerous cells can invade deeper into the cervix and spread to other parts of the body, a process known as metastasis. The scary part? This process can happen without any obvious symptoms, making it a true unseen threat. It's like a silent invader, quietly infiltrating and wreaking havoc before the defenses can even realize what's happening. Now that we've set the stage, let's delve into the causes of this silent invader. What could possibly be behind this menacing disease, you might ask? Well, let's pull back the curtain and delve into the heart of the matter. Cervical cancer is a bit like a sneaky villain, lurking in the shadows, and three major culprits often play a part in setting the stage for this disease. The first and foremost is the notorious human papillomavirus, commonly known as HPV. This sly virus slips into cells and meddles with their inner workings, causing them to grow and multiply in abnormal ways. A real puppet master, isn't it? Now let's meet the second accomplice, smoking. Yes, you heard it right. The toxins from those smoky tendrils not only damage lung cells, but can also wage war against the cells in the cervix, making them more susceptible to the manipulations of HPV. It's like handing over the keys to the kingdom to the enemy. And last but not least, a weakened immune system. This is like having your castle's guards asleep on the job, making it easier for HPV to run rampant and cause havoc. Conditions that weaken the immune system, such as HIV or long-term steroid use, can give HPV the upper hand. These causes are the sparks that could potentially ignite the fire of cervical cancer. But remember, knowledge is power. By understanding these risk factors, we can take steps to guard against this disease and keep the villain at bay. So how does one know if they're dancing with this silent threat? That's a great question. The tricky part about cervical cancer is that the early symptoms often whisper so silently that they can easily be ignored. The signs might be as subtle as irregular periods or abnormal bleeding, or as seemingly unrelated as back pain or discomfort during urination. As the disease progresses, these whispers become louder, turning into a persistent pelvic pain or unexpected weight loss. It's easy to dismiss these symptoms as ordinary nuisances or attribute them to stress, but these could potentially be your body's way of raising a red flag, indicating that something is not right. Now here's the thing, no one wants to live in constant fear, scrutinizing every ache and pain for signs of cancer. That's where regular screenings come into play. Just as a smoke detector alerts you to a fire before it becomes a blaze, screenings can spot cervical cancer in its early stages when it's most treatable. Consider them as your personal alarm system, designed to detect the silent whispers of cervical cancer before they turn into a deafening roar. It's not about living in fear, but embracing a proactive approach to your health. Recognizing these signs could be your first step towards winning the battle. So listen closely to your body's whispers. They might just be telling you something crucial. Armed with knowledge, how does one stand against this formidable foe? The battle against cervical cancer, like any other battle, requires a well-thought-out plan. The first line of defense is surgery. Depending on the stage of the cancer, various surgical procedures can be used. These range from simple procedures such as a cone biopsy, which removes a small cone-shaped piece of tissue from the cervix, to more complex operations like a radical hysterectomy, where the uterus along with the cervix is removed. After surgery, or in some cases in lieu of it, there's radiation therapy. This treatment uses high-energy rays or particles to destroy cancer cells. It can be delivered externally by a machine that directs the radiation at your body, or internally through radioactive materials placed inside your body near the cancerous cells. Then there's chemotherapy, the third pillar of our battle plan. This treatment uses drugs to kill cancer cells throughout the body. It can be used in conjunction with radiation therapy to enhance the effects, or as a standalone treatment when the cancer is advanced. But remember, the earlier the cancer is detected, the more effective these treatments can be. Early detection is the key to successful treatment and recovery. And how can we ensure early detection? Through regular screenings, of course. Pap tests and HPV tests are your best allies in the fight against cervical cancer. They can detect precancerous changes in the cervix that can be treated before they turn into cancer. Consider this. When cervical cancer is detected at an early stage, the 5-year survival rate is around 90%. That's a number worth fighting for. So there you have it. The battle plan against cervical cancer: surgery, radiation therapy, chemotherapy, and most importantly, early detection through regular screenings. It's a formidable lineup against a formidable foe. Remember, knowledge is your greatest weapon. Stay vigilant, stay strong, and never underestimate the power of a regular checkup. So what's the crux of this discussion? What should you take away from this conversation? Let's recap. Cervical cancer is instigated by various factors, including the notorious HPV. It whispers its presence through subtle symptoms like irregular bleeding and pelvic pain. But we have a battle plan. Regular screenings, HPV vaccinations, and healthy lifestyle choices are our weapons. Your health is in your hands. Empower yourself with knowledge and take control of your well-being. Remember, early detection saves lives.